The MNsure Oversight Committee recently met to receive an update on the MNsure system, as well as reports on enrollment figures and system deficiencies. Here's a portion of that committee.
As with any startup opportunity, we will have growing pains. Our growing pains have been and will continue to be the subject of news coverage and public debate. I believe that's a good thing. That's how MNsure will continue to improve. The MNsure board is committed to soliciting feedback from consumers and stakeholders.
I want to, if I can, take members back to January. That was when we took a step to bring in Optum to conduct an end-to-end review of our system, of the MNsure system. It had not performed well in the fall. I don't think that's news to anyone around this particular table, and we felt it was important to bring in a trusted outside entity to have a look at the system and give us some recommendations. They brought back a number of recommendations in a number of areas, including how to improve some of the service in our contact center, the program technical management, as well as the software and underlying data systems. And we started the process of bringing on a key recommendation from the Optum report, which was that the project truly needed a general contractor, someone to oversee the overall work of the project and ensure that the vendors, state staff, and state agencies were working closely together to ensure that we delivered on the project. When I took this role back in December, I made a commitment to this committee and to the public that we would be a transparent organization and that we would provide information about what was working in the system and what was not working in the system, and we would do so in an open manner. We've tried to do that and strive to do that, and we're committed to continuing that process. I think the work that Deloitte, the contractor that we did bring on to help us do that general contracting, and the work that they're bringing forth is I think, our goal is to make sure that that information not only guides what we're doing and the improvements that we're making, but is also available to the public so that they understand the process that we're going through and the progress that we're making as well.
But I wanted to highlight just a few things as the main study results. The first of those is that the number of uninsured Minnesotans fell from 445,000 to a little bit over 264,000, which was a reduction of over 180,000 people during this time period. That corresponds to a reduction in the uninsurance rate from 8.2% of the population to 4.9%. Second major takeaway, I think, from the study is that most of the coverage gains occurred in the state public insurance program. So those increased by about 155,000 people on net. This wasn't particularly surprising to us since it's long been known from research conducted by the Minnesota Department of Health that a sizable percentage, about 2/3 of the uninsured, were eligible for public programs and yet not enrolled. And then the third major finding from the study is that private health insurance coverage also increased during this time period. So we saw a net gain of 30,000 in the number of people with private coverage. There was a gain of 36,000 in the number with non-group coverage, and that was balanced by a slight loss of 6,000 people who had group coverage.
Again, that was a portion of the MNsure Oversight Committee. For Senate Media Services, I'm Julie Bartke.